So how do we diagnose this strep zoo infection in dogs? We recommend collecting nasal and or pharyngeal swabs for bacterial culture. So this is using just your standard bacterial culturettes. When you submit this to a laboratory such as IDEXX or Antec or any other reference laboratory, on the test requisition form, you have to write in big letters, please test for strep zoo, because many diagnostic laboratories will not do it. They may report out Streptococcus infection, but they won't give you the species. Is it Strep canis? Is it Strep zoo? Is it Strep dissimili? So you have to request that. Also, be sure to request an antibiotic sensitivity panel, because this is a bacterium, and if you know what antibiotic will kill it, then that's what's going to save the dogs. Get them on that antibiotic, so ask for it. The other thing that we recommend is to collect swabs from the nose and the throat for PCR. This is the latest diagnostic test for strep zoo. It is much more sensitive than bacterial culture. If that dog has strep zoo, this is the test that's going to find it. However, it won't give you an antibiotic sensitivity. That's why we like swabs for culture and sensitivity testing and swabs for PCR simultaneously from the same dog. These swabs can be submitted to IDEXX or Antec. They both offer a canine respiratory pathogen PCR panel. And these panels are great. The test is great. And it tests at the same time on the same swab for all of these respiratory pathogens known to infect dogs. So these panels have given us an opportunity now to see if dogs infected with strep zoo actually are infected, co-infected with viruses. And did the viruses come first and predispose to the strep zoo? So this is a little bit about how to do this swab collection, especially for PCR. You need just a clean, sterile, plain red top tube. There's no serum separator plug in here. A swab with a plastic handle. This is demonstrating swabbing the nostril of a dog, and notice this technician is properly donned with PPE, wearing gloves, and even has a gown on, because it's a sick dog, and she doesn't want to get what that dog has. Then she takes another swab, and she swabs the very back of the pharyngeal area, back way beyond the tongue where the tonsils are. And each one of these swabs is then put inside the red top tube, and you can snap that plastic handle, which allows the swab then to drop down into the tube. And you can put 2 swabs in there. And that way you'll only be charged for 1 sample, and it will maximize your opportunity for finding pathogens. So that's how to collect swabs. And one last diagnostic technique that should be done for any dog that dies suddenly for unknown reason, but particularly if it's got blood coming from the mouth and nose, is to do a necropsy, or have someone do a necropsy for you, so that you can look, or someone can look inside the chest cavity for lungs that look like they're full of blood. It also allows you to pinch off some tissue from the lungs, or even take swabs and stab the tissues and submit the swabs to the laboratories for both bacterial culture, antibiotic sensitivity, and PCR analysis. What antibiotics are the strep zoo strains sensitive to based on testing done to date? Well, the good news is that all strains recovered from dogs involved in strep zoo outbreaks in shelters in the 2000s have been shown to be sensitive to penicillins, ampicillin, Clavamox, cephalexin, and even good old tribrizin or trimethoprim sulfa. All the common antibiotics. But what's missing in that list that's used? Yes, exactly. So there are strains that have been shown to be resistant to doxycycline, and not only doxycycline, but also bacterial or enrofloxacin or marbofloxacin, the fluoroquinolines. So again, I wonder if the widespread use of doxycycline has conferred some antibiotic resistance to some strains of Strep zoo recovered from dogs in shelters that use that antibiotic consistently. One really good piece of news that came out of the 2011 Strep zoo outbreak in the Florida shelter that we consulted with was the demonstration that the Strep zoo strains, at least from that shelter, were sensitive to cephalexin. This is a cephalosporin. Many veterinarians in this room know this as Convenia. It's a Pfizer animal health product. It's wonderful. And we love it because you only have to give a dog an injection once, and it provides activity against staph and strep bacteria for 2 weeks. So you don't have to give them pills once or twice a day for 2 weeks. One shot does it all. And this actually was important for us to find out, and Pfizer provided great assistance with us to determine this, because this provides a great tool for treatment of dogs either infected with Strep zoo in a shelter or exposed to dogs infected with Strep zoo and may have the infection themselves. Now you just give them all in a Convenia shot one time, and it gives them a 14-day activity against strep. So that's a lot better than having your staff try to treat every dog in the shelter once a day with a penicillin injection. What if you have 400 dogs to treat? Or to give them Clavamox twice a day, which would be horribly expensive, or even cephalexin twice a day, which would be cheaper. But again, look at the labor and look at the chance for cross-contamination of dogs as you move from dog to dog to dog, treating it once or twice a day for days on end. So remember Convenia.